between Zoom and the agenda. Whoops. Okay, let's go ahead and start with introductions, and then we'll go to our land acknowledgement.
Okay. Brad, we'll start with you and then Elizabeth.
Hi, everyone, Brad Porterfield, Chair of the Community Advisory Council, Consumer Representative.
Elizabeth Schmidt, Vice Chair of the CAC. Thank you.
Next, Mandy, and then Connor.
Hi everyone, Mandy Seeley. I use she, they pronouns, and I am a consumer rep in Sisters.
Hey everyone, Connor Carlson. I am a consumer rep out of Bend.
Excellent. Next, we're going to do Miranda and then Elaine, please.
Good afternoon, all. Miranda Hill with Klamath County Public Health. I'm a CAC representative.
Hi, everyone. I'm Elaine Knob-Schultz with Mosaic. I'm the Director of Strategy and Development, and I am a community representative on the CAC.
And then we have actually two guests from Mosaic today. We have Miriam and Sonia. If you'd like to introduce yourselves as well, please.
Yeah, my name is Miriam. I'm the community health worker supervisor for Madras, Redmond, and Prenville.
Hi, everyone. Thank you for having us here. My name is Sonia, and I am a supervisor for the community health workers as well for Bend and the pediatric team.
Welcome. Excuse me. And next we have a few new faces for the Health Council staff. One familiar face, she is back, Donna Mills, if you'd like to say hello to everybody.
Good afternoon, everybody. Donna Mills, and I am serving as the Interim Executive Director for COHC.
And then we have two program managers. We have Mary Burns and Avery Grace, if you could say hello.
Hi, everyone. I'm Mary, and thank you for having me here today. I joined the COHC team this week.
Hi, friends. Avery Grace, they, she pronouns. I'm glad to be here with you.
Excellent. That is all of our CAC members, our guests, and our new attendees here. Brad, I'll turn it over to you.
Okay, since we have so many new people, how about let's just have everybody introduce themselves.
Perfect.
Yeah.
All right, we will start with, let's do Kristen and then Dustin.
Hi, everyone. Kristen Tobias. I use she, her pronouns, and I am the Senior Community Health Coordinator for Pacific Source, the coordinated care organization here in Central Oregon. I think this rain is also making it hard for me to wake up.
Hi, everyone. Dustin Zimmerman, he, him pronouns. I'm based in Portland, so it's still the freeze here, although we're starting to get some rain. Nice to see everyone again. And I am your innovator agent with the Oregon Health Authority.
Next, we'll go with Martha and then Katie.
Hi, sorry, had to connect my mic. Martha Edwards, she, her, pronouns, and I'm the Health Equity Liaison for Central Oregon and the Columbia Gorge at Pacific Source.
Hi there, she, her pronouns, Katie Orkies. I am the Outreach and Education Coordinator with the Oregon Health Insurance Marketplace for Central Oregon and the Gorge.
Okay, we'll move on to the rest of our Health Council staff, Camille and then Miguel.
Hi, everyone. I'm Camille Smith at the Health Council. I use she, her pronouns.
Good morning, everybody. Sorry. Miguel Ángel Herrada, Central Oregon Health Council.
And then lastly, Michaela, and then myself.
Hi, everyone. Good to see you all again. I'm Michaela Arsenault, Project Manager at the Health Council. pronouns she, her, hers, and I serve as the CAT co-coordinator for the group.
And hello, everyone. Kelly Adams, she, her, hers. Health Council, I am moving into the grant platform manager position, but filling in today because Bradley is not here. That should be everybody, Brad.
All right, thanks, Kelly. Okay, I'm still trying to navigate my screen here. Here we go. All right, do we have somebody who would love to read the land acknowledgement?
I'm happy to.
All right, thanks, Connor.
Right. We recognize and acknowledge the indigenous land on which we live, work, learn, play, and grow. This is the land of the Warm Springs, Wasco, Northern Paiute, Tenino, Klamath, Molalla, and Yahuskin. We acknowledge them as the past, present, and future caretakers of this land. It is on their traditional land where we partner to improve the health and well-being of Central Oregonians. We aspire to be good guests honoring the concept in the Warm Springs culture. This land is for you to know and live upon and pass on to the children.
Thank you, Connor, sorry, Carl. Thank you, Connor.
No problem, Porterfield.
A real quick reminder, meeting practices on the Community Advisory Council, we do our best to use plain language and speak in a way that everybody will understand. So we try to avoid acronyms and any whatever high language that people might not understand or lingo, to make it as comfortably and welcoming as possible. So we also invite people to use the what are they called? The reactions. If you would like to raise a hand or speak up at some point, you can do it that way. You can also just do this to get our attention, and hopefully somebody will notice you. Sometimes we do, sometimes we don't, but we do our best. And we definitely encourage anybody who wants to speak up when the time is right. Alrighty, so public comment and patient story or patient story. Is there anybody who would like to share, either who has a public comment or would like to share a patient story?
So Brad, can I jump in and say that Sonia and Miriam, I actually told them about this opportunity for public comment because I was hearing about some issues that our community health workers have been having with the OHB Flex funds locally, and thought they had some really good perspective on how to make it better for all OHB patients and partners using Flex funds. So Sonia or Miriam, I don't know who's going to jump in first.
Hi, I can go first. So I just want to say really quick, like I appreciate like the whole support that we have with Pacific Source with the Flex Funds, and I hope everybody is familiar with the Flex Fund program. If not, this is something that Pacific Source helps out patients with getting items that's not covered through their insurance, such as like aquatic pass, pool pass, aquatic pass, gym pass, or sometimes even rental assistance. And what we've been facing lately is like the turnaround of the application process. And some of these things can be like a financial barrier for patients that are facing, like, for example, like the rental assistance, because it can take up to like 30 days for the application and for someone to reach out to the advocate that is being looked at and reviewed. And then it can be another 6 to 8 weeks for the process of the item to be approved. And I think it's kind of like frustrating on the patient because of like the whole waiting time and just to have this delegate a little quicker. And we want to serve our patients the best we can. And I know sometimes with the circumstance, you know, Pacific Source is trying to do like the best they can, but like with these kind of situations, it's kind of frustrating for the patient not getting like the communication and getting these items quicker because of like their financial barrier or health that they're facing. And there's much more, but I don't want to say all of it. So I don't know if Sonia has other stories.
Add something, Sonia?
Yeah, thank you. I guess we can all agree that, Flex Fund is trying their best and is clearly working towards to the patient care, right? So we understand that, staffing is working as hard as they can. And I think for us would be the most supportive when we're giving those timeframes, right? If it's an urgent request and they are taking 6 to 8 weeks, but an additional 3 to 5 weeks for that check to be mailed out, I guess it would be more ideal for us to know an actual time frame, right? So let's say a request gets approved on January 1st, but after January 1st, we still have a wait. So technically, we're relaying that approve notice to the patient, and they keep calling us saying, hey, my landlord has not received the check payment. It's been 2 weeks since you gave me the approval. And so that kind of puts us in a tricky situation when it's kind of out of our hands and not clearly out of like the processing service through like the patient support system, right? It goes into like a check cutting, I guess, process after it's been approved. So I guess for us, for our team, what we would like to suggest is, if possible, like to get more of a clear standpoint and time frame when it comes to the full process, including 6 weeks plus 3 or 6 weeks plus 5. And also the communication that's being done, like I feel that we've encountered some situations where a check is being mailed to the landlord, but there's no tracking system. And so recently, we had a patient who applied for a flex fund in early summer, was approved in September, and the check was mailed out to the landlord. But until this day, the landlord has not received it. And so we need guidance on how to support this patient and avoid from them being evicted, which they have a week now to present that check, and who we contact, how do we escalate that type of scenario.
Well, for that scenario, sorry, I'm Chris with Pacific Source. Can you email me directly and we'll get that figured out right away? Just to acknowledge all of your concerns. Both the Flex Fund team and accounts payable team have just been really chronically understaffed. And I mean, we also hear your frustrations. It's taking about 8 weeks, just for some of the non-urgent requests to even be like looked at. I was curious though, how are the Flex Fund requests you're submitting? How are you submitting them?
Through Mailgate portal.
Through email?
Yes.
So the other thing that we hear from our Flex Fund team a lot is if there's missing information on the Flex Fund form, then that Flex Fund team member has to follow up with whoever submitted it, which sometimes can take a really long time to hear back from either the member or whoever helped the member. And so also worth noting, that's one email address for almost 500,000 patients across the state and a team of 6. So we totally acknowledge that this is an issue. It's been a growing issue. Things that can sometimes help is through the Connect Oregon portal. It won't let you submit it without every field being completed. There's also a way to communicate directly through the portal on like updates, timelines, things like that. I'd also be happy to ask our Flex Fund team to come and talk to Mosaic and the traditional health worker team there to listen to your concerns. And, I think we all want to find a solution, but it's just been so hard to keep staff. And, so I know like my brother-in-law's a care manager, member support specialist, and he's been working every Saturday to help the MSS team since September of last year. So it's just, yeah. But I thank you for sharing the story. I will put my email in the chat. Please reach out, especially about anybody who's like a check is lost or out there floating around someplace. And also if there's anything else you want to share, and if we don't have time here, you're welcome to reach out and we can set up a time.
Oh, yes, of course. Thank you so much, Kristen.
Kristen, really quick, I know you did mention like the mail gate sometimes it's not like a, you know, do you guys do like the United Us, like the processing? Do you feel like that has been helpful?
I think it's been helpful in that the forms have to be fully filled out when they're submitted. So that is decreasing the amount of time that team has to try to get information. Like we might receive like a rent request and there's no sustainability plan. We're not going to approve it. It can't be approved without some kind of a sustainability plan. And so if like that field is missing, that member support specialist has to then reach out and try to figure out what that sustainability plan is and fill that information in. So I think the nice part about Connect Oregon is just one, it's not going to one email address that's getting hundreds a day. And two, it would have to be complete to be submitted. So hopefully just reducing any follow-up that team needs to make a decision.
Okay, yeah, and I think another thing was that some of the members like applications that have been submitted, then they submit it late, like in November, but then they realize like in January their OHP plan has termed, so they basically will miss, you know, that item that they were requesting because they don't longer have Medicaid. So that's one of the conflicts like that we also been seeing in our team, that they have OHP, but then when it comes to the new year, they renew and then they don't have it anymore.
That's the first time I've heard that. So I'll also kind of bring that back. I hadn't heard that happening before. So I guess people are just starting to have their OHP term though. But okay.
Can I do a 1 minute history, Brad? Just a shout out to say that I don't know if people know this, that I think like 11 years ago, I think I'm the only remaining member from the beginning of CAC in Central Oregon, but maybe 10 years ago, there was no flex funds. And this CAC did a pilot of taking money and I remember in my office, I worked with other CAC members to brainstorm what types of things, a type of fund like the Governor Kitzhaber air conditioner that would help a woman stay out of the emergency department. What kind of things more like that would be needed by patients? And so that pilot was actually eventually turned into the flex fund. So this group actually made the first edition of this that now I think is all over the state. So I love I get to hear our community health workers using flex funds to help patients every day, every week. So just an appreciation of what has also come and evolved out of this group and the idea of flex funds.
Thanks, Elaine, and thank you, gracias, Sonia and Miriam. We do need to move ourselves along. It was really nice for you to add that, Elaine. So CAC members know what's possible in terms of your contributions. Well, let's go ahead and move on to announcements. Are there any announcements from staff that we need to cover right now?
The combined board and CAC meeting has been postponed, so we will not have the combined meeting in February, but we're looking for a new date.
Okay. Good to know. Anything else before we move on? All right. So now we have our notes from our December meeting to approve, or if there's anything anybody would like to change, anything in the notes that doesn't accurately reflect our time together. We were actually together in person in Redmond in December for the first time.
not
that?
changed, Brad, but do you want me to respond on page 5? There was the prenatal vitamin question.
If it's something you can do quickly, yeah, go for it.
Yeah, so we cover prenatal vitamins. OHP covers prenatal vitamins. We have 7 pages on the formulary of prenatal vitamins to choose from. And it's also a 90-day supply that can be mailed to a member's home. So if you have any questions about that, reach out to me. I can drop the find a drug thing into the chat and stuff like that. And then also we have a newer home visiting program called Family Connects. And it is a universal home visiting program for any family that has a new child in their home, including like a foster child. And it provides, I think, up to 4 visits from a registered nurse, and they can also screen for social determinants of health needs or refer to other home visiting programs if the family has additional needs. And that is in all of our counties. And I think we supplied some brochures, but if anybody has questions about that, I'm happy to be a resource.
Thanks, Kristen. And I don't know, I had sent some comments to Bradley about the just stuff like the introductions was carried over from the previous notes, and it still looked like we had met virtually, but we didn't. If you could scroll up real quick, whoever's doing that. Introduction, oops, go back to introductions, down, sorry. Yeah, so it still says Kelly Adams facilitated introductions. We all, in this case, we were together in person. And if I remember correctly, we just all introduced ourselves, including some of the children who were brought to join us at that meeting. So that's just a simple thing to tweak, please. And there was no chat being used. There was no virtual presence at that meeting. So, CAC members, if there's nothing else, this is your moment to speak up if you see any other issues with the notes. Otherwise, we'll consider them approved as accurately representing what happened. Going, and gone. Okay, notes approved for December. Thanks, everybody. Next are our breakout groups. Kelly, are you managing that, or who's managing that?
I got it.
Thank you.
So we typically have small breakout groups for our CAC members and our support staff that is here, our support and guests. And today, just going along with our lovely weather that we've been having, how do you make the most of your snow days? Do you venture outside, stay warm inside? Me. What activities and plans make the most of your snow day? Just something pretty casual for everybody just to discuss before we get into the business part of our meeting. Any questions before I move you on over?
So Kelly, if we could keep this to 5 minutes, that'd be awesome.
We can do that.
We're a little short on time. Thanks.
Yep. All right, I will send you all over now.
Are we moving right into, yeah, the rural health assessment and the plan? So that's Michaela, yep. Perfect, thank you.
There we go. Yep, right into update on the RIP. That's Miguel and I. All right, so it's been a while since we've provided an update on the regional health assessment and regional health improvement plan. So we wanted to provide just a high level overview today for you. And so we'll go on kind of with the basics of, what is a RAW, what is a RIP? Between the regional health assessment and regional health improvement plan, we'll do a prioritization. So we'll go over that, and then what kind of high level what that transition from the regional health assessment to regional health improvement plan may look like in the coming months. So the regional health assessment, it's really just a snapshot of data that describes health-related strengths and challenges within Central Oregon in our communities. And so it's data that's, you can see on our data website of things like, heart attacks, diabetes, housing statistics, things like that. And then when we go and look at the regional health improvement plan, that is really our long-term systemic efforts to address public health needs and improve community health within our region. These things are legislatively required of us to fulfill. Also, our partners from around the region have this requirement as well to complete a regional health assessment and regional health improvement plan. And so we do this work collaboratively with the public health departments within our region, as well as the hospital system, and our, all of our other community partners are involved as well as the Community Advisory Council. We follow the Mobilizing for Action Through Planning partnership as our guide to go throughout this raw to RIP process, and that was made by the National Association of County and City Health Officials. And the in-between step between the regional health assessment and the regional health improvement plan is the prioritization, and it's really that stepping stone. And this process will help us identify which of the many areas of health in our region to focus on. And the Community Advisory Council and the board will be right there helping us or deciding on which of those focus areas will go into the next regional health improvement plan. And within the prioritization process, we'll use data from the regional health assessment, consider what the state and federal priorities are, best practices. We'll use different prioritization tools and incorporate community feedback. Here's an overview of the process visually. So to make the regional health assessment, we're collecting data of all types and then doing some descriptive analysis or making sense of that data. And that data will then be put into a document called the Regional Health Assessment. And then using that data with other considerations, we'll go through a prioritization process to then come up with the focus areas for the next regional health improvement plan. And then we'll need to develop the goals and the strategies in order to produce that document, that implementation plan that we'll use to align all of our efforts. So moving into talking more specifically about the regional health assessment. So we'll go over the raw, the work plan timeline. We'll do a little bit of comparison between this process this year versus back in 2019 when we completed our last raw RIP, and some highlights and details. So within the regional health assessment, there are quite a few requirements to include. And that's things like demographic data, health disparities, health indicators, behavioral health information, social determinants of health, community assets, and community challenges. Some of that data we get from secondary sources. So we'll go out to Burfus data or Healthy Teens data to collect that information. And a lot of it you can find on our community health data website. But some of that data we collected ourselves, which is primary data. So we did that through the large community health survey as well as focus groups. And all of that data is combined, and we're working with consultants and epidemiologists to do that descriptive analysis or making sense of all that data to then make our regional health assessment for 2024. So this is a comparison of the last regional health assessment. Just to note, the months don't align, but As you can see, we did a lot of planning and preparation up and through June of 2023, so last June. And then starting March of last year is when we released the community health survey. We did community listening sessions and then some secondary data analysis. Just this past November, we did the community sharing. So from the focus groups in the community health survey, we did 6 focus groups throughout the region to then share what we, the information that we collected from those surveys back with the communities that provided that information, did some, validation, does this, reflect your community? And then what are your, top strengths and challenges within your community? And so right now we're in that data triangulation and descriptive analysis piece of the RAW. So we have all that data collected, and now it's just going through some analysis. And we plan to have the RAW published between March and April of this year. And then looking back at the last time we did the regional health assessment, this time we're hoping to publish in March and April. Last time, our regional health assessment wasn't published until September. So it gives us a little bit more time to develop the regional health improvement plan and have more involvement from our community. And this slide is just making that comparison of publishing the RAW in April versus last time in September. This time we're using MAP 2.0, which has an emphasis on health equity, health disparities, and involvement of the public. Last time we used the 1.0 version. With our community health survey, we got close to 4,000 people that responded, which was fantastic. And then this time around, we had organizations and community partners lead those focus groups within our community. So faces and leaders that are, maybe more familiar to the different communities. And then we're triangulation and descriptive analysis, doing that with the data. And so this process this time around is a little bit more robust than our last regional health assessment, but each time around we improve. All right, and I'm going to pass it off to Miguel.
Thank you, Michaela. So the next 2 slides, the next slide is to give a more detail about what happened with the RAW. The next one is about how we were preparing the work. So I'm not going to read all the information. You have also some live links in there. But the words that I want you to keep in mind is that in this preparation, really what we put the effort was trying to put the center of the attention on the community. And obviously, for that, we create some values, we create the infrastructure that was needed to guarantee that, with this idea that we are doing collecting the information in a way that was appropriate for our communities. So next slide, please. So the preparation took us, as you saw the timeline, took us more time. We devoted more time on the preparation and on the collection to really give us time to do the appropriate analysis of this information. We create the infrastructure needed, the core group, the steering committee, connecting with subject matters, etc. Next slide. So the next 2 slides is to talk about, well, one aspect was the preparation, but the second aspect was, okay, in order to do that in an appropriate, culturally appropriate way, we need to invest in the community, in those underrepresented groups that were to work with us to do this collection of information. And we make an investment really to trying to involve them, not just inform them or asking the information from them, but really for them to become part of this effort. And it was a beautiful experience because we have fantastic results that I'm going to show you in the next slide. So just to give you an idea, the survey is not represented here, but the survey that runs through several months, we ended with almost 4,000 hits for the survey, which is very consistent. We have a report that of more than 141 pages where you can consult by the entire region or by counties what are the results about what the community is saying about the challenges, the opportunities, the quality of the medical services, but not only about that, also about what they are experiencing in life that could enhance their quality of life. That was related to the survey. And these numbers that you have in front of you is just about the focus groups. So we conducted 17 focus groups on different formats, not just focus groups, but also walk-along interviews. In total, just to give you an idea, we got 475 pages of transcript of information, so 22 hours of audio, and in English and Spanish, or some of them bilingual. And this information was put together to try to identify what the people was talking about. And we produced, next slide, we produce 2 reports that are alive in the links for you. So the first report that you have there is a report from the focus groups, and you can see what are the topics that came up through these discussions with the community. It's incredible, the methodology and everything that we use. We try to use a methodology to minimize the bias or the interpretation, and we feed an intelligent program to tell us, okay, what is people saying, what are the concerns. And this is one of the reports of the focus groups. The second one of the community health survey is the one that I told you. It's more than 150 pages where you can check what is what are the communities talking about in the survey. You have all type of information. I don't want to show you right now. We don't have time, but please navigate to this. These are not ready for public consumption yet because we envision that these could be more that to have a more friendly version. For right now, there are only reports. So that means that they're public. And some of them, like the focus groups, we have been able to include that in our community base and database. So include them as keyword only, but maybe in the future we will be able to bring to you something that is more friendly for consultation. Next slide. And then the last part of these slides is to tell you when we collected information and we produced the reports, we came with a final step that was bringing back the preliminary results to the community to ask them, is this what is the information that we collected something where you can see yourself or your community? And so we have a total of 6 community health feedback sessions. It was very well attended with some 300 people participating there, and more than 50 volunteers in total leading these groups, showing the results. And we use that opportunity also for collecting information, complementary information for the reports. Next slide. Yeah, this last slide of this section has a link to one of the events in Bend where the news was there. And as you see, we create, among others, the incentives for people to attend these meetings. It was very successful. We have all types of communities represented and a lot of community members. By the way, many community members sign up to participate on the entire process. So not only they wanted to participate, but also they wanted to continue be part of this, which is a fantastic opportunity for us to continue building this collaboration and opportunities with our communities. Thank you, Michaela.
All right, now we're moving on to looking ahead for the Regional Health Improvement Plan, going over their timeline, comparing the timeline process overview. So this is our timeline for the Regional Health Improvement Plan. So we're looking at this year, 2024, with the RAW being published March or April of this year. We anticipate May and June being the time that we'll go through the prioritization process and focus areas selection. Some of you may recall from the last process, we used what was called a modified Hanlon, and basically scoring and ranking different health conditions. And with that information being given to the Community Advisory Council and the Board of Directors to make the decision on what focus areas would be in our current Regional Health Improvement Plan. And so with the focus areas selected, we will then be able to develop the Regional Health Improvement Plan. And this time around, we're wanting to give us more time to develop the Regional Health Improvement Plan and have more input and involvement from the community and experts, and doing a little bit more of the root cause analysis within the plan so we can have a smooth transition when we start those RIP work groups in 2025. And so with the requirement, we have to publish in January of 2025. Yeah. So a little bit more detail on that process. The Health Council staff is doing some initial planning on what that process looks like, so that kind of larger scale overview, without getting too much into the details. And then we'll be sharing that information with you along the process, as well as bringing it to the RAW RIP core and steering committee. And then May, June is when we'll do the prioritization with the CAC and the board making the selection of the focus areas. July through December will, involve you, the Community Advisory Council, work group members, and different community partners and experts in the development of the Regional Health Improvement Plan. So kind of an overview of the subject, selecting those metrics that are in the plan, doing a little bit of root cause analysis to get to our strategies that are within that plan, and then we'll publish in January. A little comparison of how this time around will look. So we'll have a little bit more time to write the Regional Health Improvement Plan. And we're hoping to include more folks within developing of that plan. And we'll have, same as last time with the background metrics goals. This time we want a little bit more root cause analysis. We'll include those evidence-based strategies like last time and emerging best practices. And, the 2025 RIP will be our plan as a region and community to make sure we're all aligned in the efforts and we're kind of, metaphorically all rowing in the same direction to improve health within the communities. Thank you. Any questions?
Anybody? Questions, comments? Okay. So we're looking at March, April, and prioritization May to June. That's kind of our next duty, yeah?
Yep.
Prioritization process, okay. Very good. And one of the pieces I just wanted to throw out as a reminder is hopefully we can get a breakdown of how many of the survey and focus group respondents are OHP members.
Yeah.
So what that requires or when we can expect that, but that'll be really helpful.
So we have that data. Bradley Gardner is doing the graphs for that. So I would anticipate we'd have that ready for next month.
Okay, fantastic. Thanks. All right, well, anything else before we move on to our 2024 Community Advisory Council planning? Okay, let's, I don't know, Michaela, do we have a visual of what was shared? It's in the packet, but, or in the notes, what was shared, both by survey and then in person when we met in December by CAC members?
Yeah, let me share my screen.
I also want to acknowledge there are only half of us here now with Elaine gone, but we can still have a good discussion and then continue it when we get more members, hopefully at our next meeting.
Kelly, my share screen is acting a little funky. Would you mind sharing your screen? The PowerPoint slides?
Are you talking about the Google ones? Okay. One moment.
And while we're doing that, there's a couple of kind of business pieces of business that we want to take care of. Actually, I'll put them on the table, but then since there's only half of us here, we're probably going to do them offline through email response. But one of those is our meeting time, day and time. So I just want to check in to make sure that this time, third Thursday, 12 to 1:30 is still working for everybody. If you have any conflicts that you foresee coming up or it's not going to work well in the future, please reach out to Michaela and let her know, and me, and reach out to me as well. But it's hard to imagine us finding, any better of a time, but we never know until we ask. So please just reach out again offline. We won't take up time right now doing this since there's only half of us here. But please reach out by phone or email, text, whatever you want to do, if you have any issues. If not, remain silent and we'll assume third Thursday, 12 to 1:30 is our best time still. I don't know, Michaela, Kelly, do you guys want to put out a survey or what do you call it, a doodle poll? Not right now, between now and the next meeting.
Yeah, we can send out a survey or some way to do that.
Okay.
Cool. One of those methods.
Thanks. And another thing that came up in our meeting in December was there does seem to be more interest now in meeting in person. So our Community Advisory Council has been meeting virtually for, I think all of 2023 and possibly the year before that. So it's been quite a while since we've had in-person meetings. I think we enjoyed those who were able to attend the December meeting in Redmond, enjoyed that. So maybe we could look at also in the poll or the survey or whatever we end up doing, getting feedback from members on would you like to meet in person? If so, how often? Maybe we do it once a quarter. There's pros and cons always to meeting in person versus virtually. But we just at least want to put that on the table and get feedback and then make a plan moving forward for this year based on CAC member feedback. So we can do that also offline through the same process as the meeting time and date. And with that, let's look at, CAC planning. What do we have here? I apologize, Michaela, thank you for putting this together, whoever put it together. I didn't have time to look at it ahead of time, so we're all doing this together on the fly. This is the response from, correct me if I'm wrong, but from our pre-December kind of survey.
So this is the response. So at the December meeting, we provided the survey results. And then during our in-person time in Redmond, we asked folks, what should the CAC focus on in 2024? What are 3 goals? And so this is the list of the results from that.
And one of the things we did when we were kind of planning for today's meeting with Elizabeth and Health Council staff was to sort of consolidate this list into categories. And I have that list here with me in case it's helpful to you all. But it basically, my take of this long list of 10 or so things, we could boil it down into 4. One of those being consumer engagement / recruitment / stories. So different planning around that issue. So consumer engagement, recruitment of CAC members, but this all could also be recruitment of OHP members on other work groups as well. But we'll focus on the CAC. Also getting more stories. So we have kind of, I would say, a dearth of stories. Stacy's been bringing a lot, which has been really nice through her work with Kirk County. But just, I think we could put our heads around ways to increase stories. There could be a lot of different ways we could do that. And so it's your opportunity, CAC members, to bring those ideas. How do we increase consumer engagement, recruitment of CAC members, and recruitment of all members across the work of the Health Council, and stories. Another grouping was increased CAC visibility. So most members, I believe, and speak up, CAC members, if you feel any differently, but most OHP members do not even know that the CAC exists. That's my sense. And so do we want to do something about that to increase visibility of the Community Advisory Council among OHP members? Third item is our categories make a difference in dental access. So that's something that the CAC has already spoken up about. We've brought that forward as the issue that we want to work together with the board on as a combined project. And so we can continue to explore that. And the 4th category I have is trips to projects, feedback from grantees. So there's a interest among CAC members to visit some of the organizations and projects that the CAC funds through the community health projects, and or to create opportunities for the grantees, the folks who have received those funds, to report back to the Community Advisory Council on what's going on. What differences are those funds making in the lives of OHP members and their neighbors? So with that, I'd like to just open it up to CAC members to comment. Do those sound like the kind of top 4 categories, areas that we want to focus on in 2024? Anything you feel is missing?
I had a question for Dustin. The new doctor that's head of OHP, what kind of doctor background does she have? I'm thinking about that with the dental.
Dr. Hathi, let's see. Her specialty, I believe, is internal medicine, but I am not certain about that. Definitely not dental. We're still, my understanding is we're still recruiting for dental director. So.
Oh, you're going to have a director?
Our OHA director is Dr. Hathi, that started the Monday, the 16th.
Okay.
We are still recruiting for an OHA dental director. We have not had one for a while.
Oh, well, I think that's very interesting. I'd like to follow up on that.
Okay.
Thank you, Elizabeth. So CAC members, if you don't have any kind of right off the top thoughts or anything to put on the table, we could jump right into consumer engagement, recruitment stories, and get your input. Let's go item by item. I think that might help us focus.
Hey, Brad, it's Connor.
Go for it, Connor.
I think just one other thing that I might suggest is how we interact with the board. I know during our last meeting out at in Redmond a couple months ago, I don't know if that's a theme or a priority that we should have, but maybe a little more collaboration or interaction with the board or something to that effect.
Okay.
But that can be further down the list past these 4.
Yeah, and there is a connection there with the dental access, with our plan to move, to work together on that, but I think you have make a good point. It just is a more general theme in terms of continue that conversation. What does the board look to the CAC for in terms of advice? Okay. Well, let's focus on consumer engagement recruitment stories. So our CAC, I'll try to just put forth some context. Our CAC is made up of, we have 10 members, 51, at least the majority needs to be consumer representatives. So folks who either utilize Oregon Health Plan or are the caregivers of people who utilize Oregon Health Plan. So it boils down to like 6 out of the 10 of us are consumer representatives. It's a pretty small representative number. So what are some other ways that we can, either through recruitment of CAC members or other ways, to bring in consumer voice to the work that we do?
I have a question about that, Brad.
Go for it.
And this is probably a staff question. What would our ideal CAC look like in number wise? So we have 10 currently, 6 of us are consumer reps. What was the goal when this idea was created, or what is it now?
So the goal needs to be, the CAC needs to be reflective of the community that we serve. And so, you know, whatever that looks like demographically. So one of that is, you know, geographically. So we need to have good representation from all the counties that we serve. So we can look at it that way. And then we can also look at different minority groups that may be missing from our table.
Michaela, did the one I gave you the name for
Mhm.
possible, is she following up, or how's that working?
We can talk offline, but maybe you and I can meet with her.
Okay.
Yeah, I did call her though.
Okay.
I have a follow-up question. So Michaela, when you say geographic representation, there's 3 counties, right? So that's only 3 CAC members. So like, is a number too many? Because basically what I'm thinking is that like someone from each community, because Deschutes County looks different depending on which community that you're in. So would someone from each community be too many?
I don't think so. Right now we have Miranda from Public Health Center, which is fantastic. Thank you, Miranda, for being on our CAC. But we also don't have someone from, you know, just a community member from Northern Klamath. And so I think the more folks we have, communities and consumer members, would be fantastic. There's not, as far as I recall, there's not a limit to how many CAC members we can have. But we do need to keep a balance of more consumer representation than non-consumer. One of the other requirements that we have for the CAC is that we have to have a county representation from each of the counties we serve. So that's, you know, 4 county reps to kind of balance that membership out, and keeping that in mind, that we'll, you know, still need, the more, you know, county reps we have, it means that, you know, the more consumer members we'll need to have on our CAC.
I'm wondering.
Go ahead.
I'm wondering if we could develop a flyer of interest and encourage people to recruit, you know, someone to volunteer. I know in LaPine, we had a posting in the library. Wasn't that Teresa who years ago volunteered from that flyer?
Yeah, and it always helps to have, you know, a warm handoff. And Elizabeth, you've been great with getting and recruiting CAC members. we have some flyers. We're also developing more flyers, and we're working with Chris and Tobias on possibly sending out some mailers to members.
This is more on the CAC visibility, but related to this. I think it would be cool to have an event in each of the communities, like have the CAC members there, have staff there to, you know, in addition to having a flyer, you know, have staff there to say, what is the Central Oregon Health Council? And, you know, what is the CAC? And, you know, reaching out to OHP members to invite them and let them know that their voice is important and we want it. But like for me getting involved in this, it's because somebody knew about it and invited me to get involved. So I had no idea it existed until that. So I think whoever said that is right, that there's just so many people that have no idea that we even exist.
This is Miranda. So I was thinking the exact same thing that kind of Mandy just said, was that I think the CAC visibility and consumer engagement really go hand in hand. I think as we, you know, lift up the CAC, you know, this group and start sharing all this information and being able to have more than just a flyer, that's great, but being able to have that warm handoff and having the people in the community be able, so going up to Northern Klamath for me and, you know, going to their community action team group and sharing these messages, I think would be honestly really powerful. Then I think word of mouth is very powerful. So just trying to get that. And I think once we can get more visibility, I think we'll get more engagement around that. But I do like the idea of having a community member sitting on the board as well. Then, you know, because yes, I am from Klamath, but I am in Klamath Falls, which is different than Northern Klamath. So having their voice to be there too, just as the same as Deschutes having a community member than just our required representative.
A lot of great feedback. So the things I wrote down, there are a few more items than what I'm seeing on the screen. So let me just highlight what I'm hearing, and I might have added one of my own. But one is assess our representation. So that's kind of what Mandy brought up. You know, what is our goal? And I know, Michaela, we had a process for that where we kind of matched, I don't remember when that happened, but we matched like demographics, geographics, you know, geography and so forth. And we kind of said, okay, this is where we're at today. This is where we're trying to get to. So if we could kind of go through that experience again, I think that'd be helpful. I mean, we haven't changed much, but we have changed a little since I think we did that. So another kind of glaring omission is tribal involvement in the CAC. So I think we need to revisit, you know, where that's at and what we can do about it. We currently have no tribal CAC members who represent the tribes. So I want to make sure that's on there. I think flyers we can move down to visibility because it's more of a, it's really more of a strategy or tactic. Let's see what else. Another thing, so voice, if we think of consumer voice, so we have our CAC members, that's one way to contribute your voice as an OHP consumer member or guardian. But there's also existing streams of information. Once we get that OHP member survey feedback, that's going to be a huge, you know, a huge source of voice from consumers. Once we can kind of parse out who are actual OHP consumers and who isn't, and we can kind of focus in on that, that'll be amazing. But we also have Pacific Source has grievance and appeals data. That's voice. It's one form of voice. And Pacific Source also has what am I trying to say? Customer service data. So like who's calling Pacific Source and why are they calling? So that's also voice. So consumers are calling Pacific Source It might just be for guidance, it might be with complaints, but they're not going through grievances and appeals. So I think we need to tap into any and all data that already exists that can tell us what consumers are saying. And if we could build that in, I think we need to do a better job of building that reporting to the CAC into our annual calendar. Maybe a couple times a year. Maybe we can work with Pacific Source. You can speak up, Kristen, anybody else, what you think about that. But I think we need to, we've asked for it in the past, but we haven't actually like operationalized it. And I think we would do the CAC and the membership a service if we could build that into our annual calendar and just get that, have that reported to us on a regular basis. And again, not monthly, but maybe it's by twice a year, something like that.
Yeah, I can request that report twice a year. I was also curious, like, would it be helpful for me to request like a flex fund, maybe like a 2023 flex fund breakdown that could just go in the CAC packet, and it sort of has like a table that sort of shows what flex funds sort of were used to purchase and like categories. And then I think it also shows like the providers requesting, like who requests the most and things like that. And we can even just put that in the CAC packet if that would be helpful. And I'm happy to get appeals and grievance data twice a year.
Fantastic. Thanks, Kristen. What do other CAC members think about that? Thumbs up from Mandy. Thanks, Mandy.
Sounds good.
Thumbs up from Connor and Elizabeth. All right. Fantastic. Thanks, Miranda. Okay, so what else? So the one other idea, so let's look at the CAC visibility. So I also wrote down some flyers. Partner outreach is something that I wrote down in my notes. Seemed like we could reach out directly to some provider partners to see if they have any clients. You know, it could be Mosaic, for example, or it could be Family Resource Center. You know, there's a lot of client partners out there. But reaching out directly to ask if anybody comes to mind who might be a good CAC member.
Brad, are you talking about medical providers or other service providers? Anyone?
Any service provider, but I'm just thinking like the first most obvious is in the health field, since they're more likely to be OHP members. But it doesn't have to be limited to the health field. Like Family Access Network is another. I'm sorry, Family Access Network, but also Family Resource Center, or Connor is, and Myra. It's not specifically health related, but yeah, just any partners where our OHP members are interacting.
I started thinking about Summit, and Justin, you know, was on the board. Maybe he would like to use someone in Summit to kind of, there's tons of OHP members that are, you know, patients, and somehow work with them one-on-one. As we're talking, I'm thinking a flyer is better after the introduction is made through someone. That way we don't just pick somebody up out of the blue. But I think we need to have a flyer or something that kind of describes what we're doing to help a person become involved once they show the interest.
Yeah, I think we all agree, Elizabeth, that that warm handoff tends to be more effective than just having flyer. I mean, flyers also have a role, but it's a passive way of getting the word out versus a more direct person-to-person invitation or just
Well, I think Justin would be open. I've worked with him on some issues on disability, and he's very responsive if he sees an interest. So maybe staff in his clinic could coordinate that, you know. Maybe a doctor's heard a person say, I want to be more involved, or, you know, just kind of, I don't know. They could work it though.
Yeah. So you gonna reach out to Justin?
I will. I could call him. I don't have his phone number. I had it once, but
Fantastic. I think the staff could get that to you.
okay, that'd be great.
So Brad, I think
has ideas. Yeah, Mandy.
so I think this is really awesome timing that we're talking about this, because we did have so much interest in the community health survey that we could kind of have a like recruitment engagement campaign during this process to say, hey, you know, you look what we're doing, you know, get involved in this process that we're doing and have your voice heard for, you know, these priorities to make, you know, health equity better in your community, or just something like that. I just think it's really good timing. So I just wanted to point that out.
And one of the questions on that survey, you know, was about insurance status, but then also, you know, whether or not they wanted to be involved in the future. And so we can definitely pull from that list.
One of the things, can I jump in? At Mosaic, we have our own patient advisory councils. And so we've in the past talked up our patient advisory councils and this. And let me tell you, it's hard to get people on our patient advisory councils. It's really hard to get providers to talk about things like this in their short time. So I think flyers are great, and social media posts, like we would totally blast this on all of our Mosaic social media posts. We could put up it on our internal. And the other group I thought of is COPA. So Mosaic and COPA serve the most OHP members in the region, right, as primary care providers. And so we could get out the word to a lot. It's just, I would not put a lot of effort into trying to get individual providers to talk to people, because it's just, I've seen it put a lot of effort and not have any outcomes. The more we could just get out the word and people motivate themselves and there's someone to contact. And I just had this idea of Homeless Leadership Coalition. Every quarter, they do like hey, are you interested in joining the Homeless Leadership Coalition? Come to this orientation overview. And anyone can come before you fill out the application. And I just think it's a really nice way for people to learn more and then find out what it's really about. So I don't think we've ever done that, have we? Like had a set, like on our flyer once a quarter, here, come for an hour and learn about the CAC.
I started thinking about Larry, that, you know, he works with the homeless. He used to be our co-chair. And he might be helpful in coordinating the homeless situation. And does it make sense, Elaine?
Yeah, again, we might get one gem, you know, one person, but it's so hard when you're thinking about where you're going to sleep that night, you know? So, but the wider net, the better, I would say. And the more we can broadcast it to Family Kitchen, you said Fan, Shepherd's House. Actually, Shepherd's House might be good because they have a program that goes like 6 months. And so they might be able to give people transportation and different things to help. So that my main point is wide net.
Elaine, I think that's a great idea, because I was on the board of HLC and I still watched every one of those orientations I could, because like the Health Council, there's a lot to know. Like there's just so much information and so many different things going on with both of those organizations that I think that's an awesome idea. And then something that came up on that same thing while I was on the board is they wanted to record one and to be able to put it on the website or to be able to share it. That way, you know, they weren't having to find somebody to go and do the training and all of that. So to have those materials easily available for like us to send somebody via email so they can just watch it on their own time instead of having to be at a meeting. And then they were also talking about what I had said earlier about coming into each community and doing one for the community itself, having a Q&A for those questions that come up collectively at each one of those events too. So thank you. That's a great idea.
I think another one could be Connect Central Oregon. They do volunteer and board member support, and they might be able to help us. I know this isn't for board, but you know, we could at least maybe talk to them and see if they might have some ideas.
Yeah, good suggestion, Connor. The only question, one question I want to have for CAC members related to the idea of actually having a presence at community events is who would actually do that. So I got to remind us that we are a volunteer community advisory council. We're all volunteers, and so are you suggesting that CAC members would be the ones to table at community events, or like what? I'm just curious about your thoughts as far as who would do it and what that might look like. Are you thinking health council staff, and they only they have limited time, so we have to get into the weeds on that a little bit.
Of course, I want to bring up an issue. Since we're volunteers, maybe we pay a stipend for the CAC member to be present and staff coordinated overhead. When people are paid a staff stipend, they're more likely to show up, or a guest card or something.
I think we do have that built into our CAC system. So yeah, that's absolutely possible. We just need to kind of know what that budget is and communicate with each other on it. Yeah, Mandy.
So when I said having a presence at every community event possible, I was thinking along the lines of a staff member and a CAC member from that community, if we have one. So like, for example, if there was the possibility of there being an event that we could be at in Sisters, if it fits my schedule, like I would always volunteer to do that. Not as likely to go to Bend or Redmond or anywhere else unless I had to be. But you know, maybe it's all right, who's available this month or for this event or whatever. And yeah, that's what I was thinking myself.
Thank you, Mandy. Fantastic. Yeah, so there may be, I guess we could at our next meeting and or offline through a survey of some sort, poll our current CAC members as far as availability, willingness, and so forth to do that kind of thing.
Hey, Brad.
Yeah.
I just also wanted to mention that, Pacific Source, we try to table events as well. I think Martha's on the call too. It's sometimes just like me and Martha, but, and CAC members are always willing to like join our table. We have tent and table and things like that as well. So, I don't know of any events coming up currently or right now, but as spring, starts, I imagine those opportunities will be coming around. So happy to share those with the CAC as they come up. And but I just wanted to put that out there too, that more than welcome to join Pacific Source.
Thank you, Kristen. One other quick thing, I just want to acknowledge that we're running out of time. It's almost 1:30. But one other thing that always occurs to me anytime a mailing comes in the mail, an OHP mailing, Pacific Source mailing, is that's something that already happens, it already exists. Is there any way for the CAC to get a notice in one of the mailings that's going out to all members? Because it's already happening, there's no additional costs, at least in theory. Is that an option, Kristen, or whoever would want to respond?
I try to send out some of our partners an email as soon as I get the flyers from Marcom. So if you're interested in receiving those, there might be some that I miss, but I, try to stay on top of that. If you want me to send those to you, you can send me an email and let me know.
Martha, is there any way to add, like a plug for the CAC on one of those flyers that's already going out?
What do you mean? Sorry, Kristen.
I was gonna say the CAC is always mentioned in the member newsletter, which goes out, well, it went out this month. So we always mention the CAC there. It's also on the website. Sorry, Martha, did you have another thought?
No.
Okay. But we could talk to Marcom about, we try to do like one more mailer each year that would go to all of our CCO members. So that would be probably like the third quarter where we would really start to want to have an idea of what that could look like. So happy to talk more about that and take that offline and brainstorm what that could look like. But we will send one more mailer out to all of our CCO members this year.
Okay, appreciate that, Kristen. Yeah, because I haven't noticed personally any mention of the CAC, but that doesn't mean it wasn't there. But I will double check on the things that I've received in the mail from you all, from Pacific Source. But that would be, I think that's, just taking advantage of something that's already going out would be amazing. And then
I will also find a PDF of the member newsletter that just went out recently, and I will share that with the Health Council to send out to the CAC.
Thank you.
Sorry, I just had an idea. When we table events, whether it's us or one of our other partners, maybe having some sort of flyer or, half a page about the CAC that we can also put out on our tables could help. At least that can start the conversation about what is it, and just start that.
That'd be awesome. Thank you, Martha. All right, folks, so we are out of time. So we will look forward to the next meeting and continuing our discussion around making a difference in dental access. So that's going to feed into our work with the board, combined work, and which is we're no longer meeting in February with having a combined meeting. So we can have some time just as a CAC to discuss that at our next February meeting. And then getting feedback. So, think about the ideas you have for how we could build into our annual calendar, getting feedback from grantees and or taking trips to visit projects of our grantees. And we can bring that to our next meeting together and get your input. Anything that you would like to say before we part? Time goes quickly. I think we made some great progress. Thanks everybody for your input, and we'll start to hash out these ideas and put together a plan for the year as we roll forward. Welcome to the new Health Council staff. Welcome to the guests from Mosaic. I'm glad you joined us, and we will see you all in February.